Good morning, everyone. My name is Matthew McQuillan, and I am the chair of the Department of PA Studies and Practice, and it is my honor and privilege to be with you all today as we officially open our HOPE Clinic, otherwise known as our Health Outreach Practice Experience. The word hope is defined as a feeling of expectation and desire for something to happen. Well, today we proudly announce that the expectation has become a reality. HOPE builds on a tradition that was started over 10 years ago with our former medical director, Dr. Joe Schwenkler. I can recall sitting with Dr. Schwenkler on the train coming back from a conference in Washington, and he presented a concept which was building on the idea of service learning, which is something that the PA program espouses. He wanted to provide an opportunity for students to work together collaboratively along with the faculty, but do it in an environment that was serving a community in need. There were many previous locations prior to where we are today, and we are grateful for those opportunities. We provided services in both Perth Amboy and New Brunswick through clinics operated by Catholic Charities. Then we developed a relationship with a focus clinic in Newark, which was operated by the Rutgers School of Nursing. And then, when Dr. Elizabeth DeProspero joined our faculty, she brought us to St. Mary's Catholic Church here in the Plainfield area and allowed us and helped integrate us into the clinic operated by Dr. Joe Clemente. So what we have today with our HOPE Clinic here in Plainfield is an evolution and a transformation over these years. This concept is really about service learning, and it emphasizes the physician assistant profession's mission for providing opportunities for students to collaborate and build teams, as well as to provide care and access to the underserved. In this case, the HOPE Clinic actually has collaboration not only amongst providers, but here within the university and the local community. So at this point, I would like to introduce those who we have present today. First, Gwen Mahin, the Dean of the School of Health Professions. Brian Strom, Chancellor, Rutgers Biomedical and Health Sciences. Vicente Gracias, our Senior Vice Chancellor for Clinical Affairs at Rutgers Biomedical and Health Sciences. Will Green, our Vice President of Development from the Rutgers University Foundation. Nan and Dave Daly, founders of Charity Works, along with their daughter, Jenny. Ted Diaco of the Diaco Foundation. Karen Shapiro, Chief Administrative Officer, School of Health Professions. Susan Gooden, Senior Director, Pharmacy Practice, Patient and Investigator Engagement, Janssen Research and Development. Frank Gianelli, HOPE Director and Faculty, Rutgers Physician Assistant Program. Elizabeth DeProspero, Medical Director, Faculty, Rutgers Physician Assistant Program. We have several members of the Rutgers PA Faculty HOPE Committee, and they include Jennifer Joseph, Jessica Gomes, and Taya Kogan-Drew. Kate Mayfield, our Director of Development, School of Health Professions. Cindy Merlino, our Chief Business Officer, School of Health Professions. There are also a few contributors that are not present that we'd like to acknowledge, and they include Dr. Clemente and the St. Mary's team, who've taken the opportunity to pass on their community trust to us in our HOPE Clinic here today. And Beryl Sawa, APN, and the Plainfield Health Connection teams helping us foster this new community relationship. We appreciate the village that has come together to help us raise hope, including the efforts of many others, and they include donors, faculty, administrators, and students, as well as the community members that have made this possible. Teams from across disciplines here at Rutgers guided our legal, technical, and financial building blocks to make the medical part actually possible. Although not everyone could be present, this ribbon cutting is one way that we celebrate the contributions of many. At this point, I'd like to invite Gwen Mahan, Dean of the School of Health Professions, to say a few words.
Good morning, everybody. It's just wonderful to be here with all of you and see this dream really coming into a reality. HOPE has provided free primary care for underserved communities, as Dr. McQuillan said, for more than 10 years through the volunteer time of faculty, students, and university gap funding at the Rutgers School of Health Professions. As Dean, I want you to know I am committed to the sustainability and expansion of HOPE to meet the increasing demand for the program services in Plainfield and beyond. Today, HOPE operates with community partners right here in Plainfield, where we believe up to 50% of the population is uninsured, and the poverty rate is 21%. In non-COVID years, PA faculty and students treated more than 200 patients annually without fee for illness and chronic care conditions such as diabetes, high blood pressure, acute pain, respiratory illness, among others. HOPE serves as a lifeline for the uninsured. While many health issues seen at HOPE could be mitigated through routine follow-up care, they instead go unchecked for years and often land patients in the emergency room simply because uninsured community members are often afraid or unsure of where to seek care. Through strong partnerships in the community, HOPE provides a safe and reassuring environment for the uninsured to seek care. The demand for HOPE services is increasing, and prior to the pandemic, patients waiting to be seen had to be turned away because of the program's limited hours and funding. Between 2018 and 2019, HOPE saw a 40% increase in new patients. Without increased investment, the uninsured in Plainfield face an even more uncertain future of health care. In 2020, with the support of our Chancellor, and who I'm about to welcome to the microphone, I identified HOPE as one of the 3 priorities for targeted investment and expansion at the school over the next 5 years. As part of this goal, we aim to raise an endowed directorship and funding for other key resources to ensure sustainability of the program. HOPE was forced to shut down its prior location at a school when COVID hit. Rather than watch the patients and the clinic languish at a great time of need, Nan and Dave Daly identified, purchased, and renovated this beautiful new space just for the HOPE program. Countless other supporters raised significant funds for the patient's needs. And while I cannot thank them all, I would like to especially thank Nan and Dave, of course, Gidon and Halit Kusin, Ted Diaco from the Diaco Foundation, Susan Gooden and Karen Shapiro, thank you, significant anonymous donors, and so many others. I am looking forward to what the future has in store for HOPE, and I can tell you we have big plans for it. I now have the pleasure of introducing Dr. Brian Strom, the Chancellor of Rutgers Biomedical and Health Sciences, and inviting him to say a few words.
Thank you, Gwen, and it's nice to have somebody at my height to follow microphone-wise. Yeah, exactly. Particularly speaking after President Holloway, for those of you who haven't met him, when you see him on video, you don't realize how very tall he is. So thank you, Dean. It's clear from everyone's words today that HOPE has a solid foundation and a bright future. I greatly appreciate your continuing commitment to this important program at Rutgers. As Chancellor, I'm committed to medical and healthcare professionals practicing at the top of their credentials. They often within interdisciplinary teams to meet community health care challenges with compassion and with excellence. HOPE accomplishes this in the provision of primary care led by physician assistant faculty and students at no cost for uninsured community members, and I stand by the program's vision of integrating additional healthcare professionals into the team, including from the fields of physical, occupational, and speech therapy, psychosocial rehabilitation, and clinical nutrition. HOPE increases accessibility to healthcare for those who might not otherwise seek it with traditional providers, making a difference for patients and therefore the lives and future trajectories of their families. With an eye on future aspirations, we're committed to eliminating language barriers, to increasing access and enhanced treatment for patients, and a clear goal of employing people from the community in the coming years. Your dedication to HOPE, present and future, is a testimony to the program's impact on both the students who volunteer in the clinic and the community it serves. The partnership with Charity Works and other vital donors, such as the Diaco Foundation, Gidon and Halit Kusin, sorry for the butchering people's names, Susan Gooden and Karen Shapiro, significant anonymous donors, and so many others, have proven fruitful for successful launch, already reaching more than 45 patients since July 7th. I'm confident that more support will be raised to fulfill the vision of expanding HOPE to new professions and increasing its reach. Since today is about celebrating impact, we would be remiss if we didn't thank the individuals from the Rutgers PA program, the faculty who put in countless hours ensuring an operationally sound clinic for patients and students. Included are Frank Gianelli, Elizabeth Prospero, Jessica Gomez, Jennifer Joseph, and Thea Kogan-Drew. Thank you all for your ongoing contributions. It's also with great pleasure that I introduce the Daly family, founders of Charity Works, to say a few words.
So I'm going to have to move this up just a little.
That's more normal.
Well, first I'd like to thank everyone from Rutgers for being here. Thank you for all the resources and really specifically the excellent human resources that Rutgers is providing to this effort. Nan started in this effort about 12 years ago in a mobile van with no heat in a parking lot in Plainfield, and it's gone through a number of iterations, and it's nice to see it culminate with this building and this group. Dr. DeProspero, who heretofore is known as Dr. Liz, has been working with Nan for several years and has been a really integral part of that, and we appreciate that. And we also appreciate Dr. Liz and Frank working together to get this clinic up and running. Was a real challenge from a physical perspective and from an administrative perspective. And you two were, it took a great deal of trust between the two groups to get this thing to fruition, and you guys were relentlessly constructive. So thank you for that. And one thing I'd like to mention is that at one point during the construction I had locked my keys in here, which I want to do, and I had to drive over to Liz's house to get her keys so I could get back in and finish what I was doing. And she said, you know, one thing I just want to mention to you is that what a great thing this is for the clients who are coming into this place, because they are normally coming into facilities that are not being used for something else. They're often being treated by somebody who has to treat them and acts accordingly. And for them to come into this space with these people, it dignifies them in such a nice way. So I never thought of that while we were doing that, but that was a really nice thing to point out. And am I under 3 minutes? I think I am. Yeah. Okay. So I would just like to thank the Rutgers community again, and I look forward to an ongoing and expanding partnership between us. Thank you.
I'd like to invite Ted Diaco from the Diaco Foundation to say a few words.
Good morning, everyone. This is totally against my nature to sit here. I want to be behind the scenes. I don't want to be recognized. I don't need the recognition. But Frank had brought this opportunity across my desk, and the foundation had reviewed it. And I believe in life. We're all successful. We take things for granted. It is our duty and our obligation to give back to the community. And I know what I don't know, there's so many words we could describe with Frank, you know, perfectionist. And I, just a little, when he drives, I call him 10 and 2 because that's who Frank is. And the foundation couldn't find a reason why not to support somebody like Frank. And that's really, I just wish all of you a successful clinic. And I can't see why this just doesn't grow and grow and grow, because it starts with the right seeds. Thank you.